Welcome back to Clear Vision today. I'm here with Dr. Param Fagoora, who is a board-certified ophthalmologist. He's a noted eye surgeon here in Fresno, California, and he is ready today to talk with us about a very important subject in ophthalmology, a threat to your vision if it's undetected and untreated, and that is glaucoma. But the thing is, glaucoma is not a definite predictor of blindness as it used to be, is it, Dr. Fagoora?
Yes.
It doesn't mean you're doomed.
Well, glaucoma is a very serious condition because it's a preventable blindness. Now, glaucoma is defined as a group of eye conditions that can lead to optic nerve damage and visual field loss. The good news is that if it's detected early, we can prevent the visual loss to a patient, because visual loss will lead to a lot of hardship on the patient's life and also on the insurance companies. So it's very, very important to diagnose glaucoma early. Now, question comes up, who is at risk for glaucoma? Number one, if you have a race, African, Russian, Irish, Scandinavian, Hispanics are more likely to develop glaucoma, by which means these races are more prone to develop glaucoma compared to other races. If you have family history of glaucoma, you're more prone to develop glaucoma. Eye trauma can lead to glaucoma. If your refractive errors, nearsighted or hyperopia is large, you are more likely to develop glaucoma. A high pressure in the eye called ocular hypertension, you are more likely to develop glaucoma.
Hypertension.
There is a condition in the eye called iris plateau. If you have an anatomic configuration of iris plateau, you're more likely to have glaucoma at an earlier age, because your iris is sitting close to the drainage channel called the trabecular meshwork, and it can block that channel, and you will have early glaucoma. There are certain eye diseases that can lead to glaucoma, like diabetes, high blood pressure, central retinal vein occlusion, and sickle cell disease. So it's good to know your family history, good to know what eye conditions you have, and also there are certain eye medications and some systemic medication that can lead to glaucoma, like use of steroids, use of antidepressant medications, use of dilating drops. They can all lead to glaucoma.
Dr. Fagoora, are there any symptoms that might alert the patient that they need to be tested for glaucoma?
There are two main types of glaucoma. One is called the chronic simple glaucoma, also known as open-angle glaucoma. Unfortunately, this type of glaucoma has no symptoms. The only way a patient is diagnosed is by complete comprehensive eye examination with a dilatation of the pupil in the doctor's office. Now, the second, which is less common type of glaucoma, is called acute angle glaucoma. If you have an anatomical configuration and you're hyperope, you can develop this type of glaucoma when you've been sitting in the dimly illuminated or in the evening situation light, or going to the movie theater. What happens in this, the pupil dilates to about 4 or 5 millimeters, and your lens moves forward, blocks this, and you get bowing of the iris to block the drainage of the fluid, and you get acute pain in the eye, redness, halos around the lights, nausea and vomiting. And if this pressure is not taken care of in the first 24 to 48 hours, this can cause a lot of blindness, a lot of loss of vision. So it's imperative, if you develop acute pain, redness, nausea, vomiting, make sure you call the hospital or your doctor's office to be taking care of this condition. This
That's an
condition
emergency situation.
it is a very, very urgent situation to be taken care of in the first 24 hours. I tell all my patients who's hyperopic that if you develop these following conditions, which I mentioned, please call the doctor's office we are open or go to the nearest hospital and tell the emergency doctor that your eye condition may have led to high pressure in the eye so that it would help the physician to diagnose you early and start the treatment.
But other than that, there for the undetectable or the asymptomatic form of glaucoma, you just need to be screened regularly after a certain age.
I advise, and American Academy of Ophthalmology advises the patients who have family history of glaucoma should be screened around the age of 35 to 40 years.
About once a year?
Once you diagnose glaucoma and you need to be treated, then you have to be seen more often because now we're treating glaucoma. If you don't have glaucoma, then you can be seen on a yearly basis because you're more likely to develop this condition, and we want to prevent the blindness or loss of visual field in the eye.
What is a typical treatment that you prescribe for glaucoma?
Well, it will vary, as we mentioned, from what type of glaucoma we're dealing with. If you have a chronic simple glaucoma, the first line of treatment is eye drops to lower the pressure. If that doesn't work, the second line will be laser surgery. Third will be microglaucoma surgery. Fourth will be to do the typical glaucoma surgery to drain the extra fluid out of the eye. If you have acute angle glaucoma, the first line of defense is to try to decrease the pressure as much as possible. And the second will be, which really works good, is to make a small hole in the iris root, because that will allow the fluid to go to the front of the eye from the back of the eye.
So it sounds like it is the biggest threat in glaucoma is a buildup of fluid. Is that correct?
Yes, in acute angle glaucoma, the fluid cannot move from the back of the eye to the front of the eye because there's a blockage at the pupil. But there are other causes of acute glaucoma, like you can develop blood vessel in the angle, and that doesn't allow the fluid to go out, and the pressure rises quite high. So it depends upon if the vision is salvageable or not. If the vision is not salvageable, we can destroy the fluid function or the organ that forms the fluid in the eye so that the fluid is not formed and the pressure goes down.
Well, thank you, Dr. Fagoora. That's a lot of information. And of course, there is more information, but you need to see your ophthalmologist if you fall into any of those categories, and be screened for glaucoma, because if it is detected early, it is treatable. Thank you so much, and we'll see you next time. Oops.
Tom, there's some other causes of